Longevity Plus would like to thank you for joining our webinar today. Our host, Dr. Gordon, is an expert on nutrition, mineral metabolism, and anti-aging. Dr. Gordon is a consultant to Longevity Plus, where he is responsible for designing effective, natural supplements that help to support optimal health. Today, Dr. Gordon will be discussing osteoporosis. Without further ado, please join me in welcoming Dr. Garry Gordon.
Welcome, everyone. Today we have a topic that has only come to the foreground in the last few years, and that is iodine. And iodine, like many minerals, makes a huge difference in how long and how well you live. So if we understand that everybody, for example, would be anxious to take calcium, but I teach them never take calcium without equal amounts of magnesium. And many people are aware that chromium can improve sugar metabolism. And we all know that some people need iron and others may be harmed by it because there's a disease called hemochromatosis where some people can't get rid of iron. So when we start talking about trace minerals, those that we all benefit from and virtually none of us have enough of would include things like selenium, because it actually helps you handle your overload of mercury in your body. And magnesium is not adequate in 99% of people when tested properly with intracellular testing. And so iodine has been around for a long time, but it's now very important for you to understand that we all need more iodine. And today the United States government has released their new recommendations for the dietary recommendations, and they're telling people avoid salt like the plague. Now, could that be one more time that government shoots itself in the foot and gives you the wrong advice? Well, you decide for yourself when we get to the end of this, but I will tell you now that salt may be one of the only way people are getting iodine, and when you learn how important iodine is, then you may become aware that you want to get it even if you have to buy it separately, which I will recommend most people will need to do. We need it. It's essential in every part of our body. Your white cells won't fight infection unless they have enough, and your thyroid will definitely not work optimally. And how many people in the United States today are fighting suboptimal thyroid function? Well, that number will be deep in the eye of the viewer, but from my consideration, the number will be around 80+% of people would be healthier if you could optimize their thyroid function. And since they make it very difficult for doctors, unless they're extremely knowledgeable, to give you the thyroid that makes me feel good and lets my patients feel good and stay healthy year after year, then you may wind up having to do the best you can by supporting your thyroid function by making sure you have optimal levels of iodine. And it is known that I came from Madison, Wisconsin. It was the goiter belt. So the most famous clinic in town specialized in removing these goiters. And they never told anybody when they took the goiter out that you need to get on iodized salt. They didn't bother to mention, because I think they liked the business of taking your kids' huge swollen thyroid glands out, because we were in the goiter belt. But most of the country today, in my view, is in a goiter belt. That means you're lacking it because there's an increased need for it. Now, this book is a book that can help you learn more. And even though it's added to the salt supply, it still is not adequate to meet our needs today. Now, where we're going to get this iodine? Well, we can get it out of eating foods, and you can see it. These are microgram quantities in all these foods, but what's going to shock you is I'm going to tell you that my recommended dose for people is milligrams. So you just need to have 100 pieces, 100 servings of shrimp to get up to 35 grams, and that's going to mean that, excuse me, 35 milligrams. So that means that no one is really in their diet actually getting what I'm recommending today. We're deficient in our soil. Of course, that's true for all essential trace elements, which is one reason that the Beyond Any multiple, which I designed, which is the multiple that I give everyone if you don't happen to buy Beyond Chelation Improved, to get the 9 pills so that you have the full benefit of a primrose oil and an omega-3 and the oral chelator called Essential Daily Defense and the phosphatidylserine ginkgo. If you buy BAM, Beyond Any multiple by itself, you will be receiving all of the trace elements from the Great Salt Lake. But they will be in trace amounts, whether you talk cesium, rubidium, gold, or silver. They're going to be in small amounts. And so we want you to know that there are foods that are interfering with how well our body can utilize the iodine. And broccoli and Brussels sprouts are the best possible food today to fight against the epidemic of some of the toxins that we call endocrine disruptors that are in our diet today. That's why when you go to gordonresearch.com and you carefully look around, because there's a few thousand pages on my website, but if you look, we have the CNN special called Toxic America, which we saved to educate you by watching Sanjay Gupta's 2 separate 1-hour specials. You will learn how toxic your baby was when your baby was born, because that was paid for by Environmental Working Group, and that we now have proven that every woman that's pregnant is extremely loaded with these toxins, which are concentrated in her baby during the pregnancy. And now we know that going through pregnancy, being low in iodine can by itself lead to a miscarriage. But we have these environmental toxins which are disrupting how our body handles all messages. And the bottom line is that we have things in our water, food, and air that are called fluorine. That's the crazy idea that government has, that they lie to everybody and say this is the best fluorine. If you have fluorinated water, you have far less dental caries. We now have proof that when you fluorinate the water, you're poisoning babies, because little infants cannot handle the level of fluorine in it, but they don't care. Government just comes at one big foul swoop, and they have no idea that we need to individualize. And the bromine has been added to our bread, and chlorides are, you will see where they're coming from. So in spite of all the nonsense, they're telling you I would never let you or anyone you love brush their teeth with a fluorinated toothpaste unless you spit it all out and wash them out, because fluorine is not the answer to tooth decay. It is a completely toxic substance that, if truth were known, the industry that sells us the fluorine would have to bury it deep in the earth, because there would be no legitimate use for this toxin. But they've been able to lie to people and get them to put it in the water. Bromine has been increased about 8 times higher now than it was in bread about 50 plus years ago. And that bromine is another challenger to iodine, because bromine and iodine, bromine and fluorine both fight the iodine. And now you may have heard me in previous talks about polybrominated diphenyl ether. This is the flame retardant that is loaded in any one of us who fly on airplanes very often, because in order to try to not have the airplane explode should it crash, they have tons of the this flame retardant that we treated the children's pajamas and their mattresses with, but we've released it in the whole planet now, and there isn't anybody, no creature that we've been able to find from the Arctic to the Antarctic that isn't loaded with PBDE, and that's giving you again bromine, which is again a toxin, even found in Mountain Dew, which children drink not knowing that bromine has caused some young people to become schizophrenic. So it's not the best thing for us to deal with. But chlorine, they are going to put it in our water no matter what you do, but you can obviously use reverse osmosis and get rid of it. But what's quite interesting is that we know that these chlorine, which are tied to birth defects, cancer, reproductive disorders, stillbirth, is part of what is causing the need for us all to take an iodine supplement. And even though we have 150 micrograms in Beyond Any Multiple, which means that it's in everybody taking beyond chelation, that is only enough to eliminate the most serious iodine deficiency. It is nowhere near what it takes to optimize iodine in your body. So perchlorate, because it is used around military facilities, has leaked into the water supplies, and it's now in the food supply. So most lettuce that you get is proven now to have significant amounts of a poison called perchlorate, which came directly out of military facilities. So iodine is able to help fight back, and it will push out the fluorine and the chlorine and help get rid of the bromine. And so we need to have enough iodine. And what's enough? Well, somewhere between 12.5 and 50 milligrams. But it has an extra benefit for reasons that are now becoming understood. Taking extra iodine assists your body in preventing the uptake of lead from the water, food, and air. Remember, you can't breathe air anywhere on the planet without getting lead and mercury. So if you have extra iodine, it will help to form an insoluble form of the lead, and it will wind up not becoming part of your brain. So we do know that there's benefits, and these newer uses of iodine seem to even mean they increase the solubility of protein in the water. And in fact, iodine seems to even help change the structure of water, making the metals more soluble, making water more wet. The problem is, I've told you all the good stuff, how good it is, and now with today's proclamation of how dangerous salt is, that they want everybody down to a maximum of around 2,500 milligrams, which is equivalent of a teaspoon, unless you have hypertension or you belong to the black race and have increased difficulty handling salt. With the net result, they are recommending for targeted groups to cut that dose to half a teaspoon. Now, why is that a problem? Because you're not going to be getting any iodine. And now the problem is that salt isn't all the bad guy. It is, of course, nice if you're able to get healthy forms of sun-dried natural sea salt. And you can go to a lot of extent to really find healthy forms of salt, because healthy forms will always have the trace minerals like iodine and cesium and rubidium and gold that are present in ocean water. And the more that we study trace minerals, the more we find that you need these ultra trace minerals, not just the iodine we're discussing today. So salt is so important that your body doesn't function without it. You need to have it to keep balance in our body. It is needed always for detoxification, especially because the bromine, if you're still eating a lot of carbohydrates, of course, bread is the epitome of carbohydrate. And now we're having lots of researchers saying that maybe Dr. Atkins wasn't too far off the target when he was recommending eliminating carbohydrates, which is one extreme, obviously. You can take the South Beach diet, you can do different forms, but the idea is that we do need to keep some degree of balance in everything we do, but unrefined salt that we're discussing helps deal with these toxins like the bromine, fluorine, and the other toxins that we're dealing, including lead. Now the symptoms, if you're low in iodine, a goiter is what you see if you're in Wisconsin or Minnesota, where we have the huge swollen gland. But there's pregnancy-related problems. iodine deficiency can absolutely increase miscarriages, stillbirth, preterm, and even lower the intelligence of the child that is born. So it's pretty important then to understand that iodine deficiency during pregnancy will have effects, and that can include mental retardation, impaired growth, etc. So this list here, what are the symptoms of hypothyroidism? Well, if you look at this list between fatigue, which is what, almost America's #1 symptom, and muscle weakness, a low temperature. If you actually check your underarm temperature, which should be 97.6, and if you come in considerably colder than that, then you have some problem going on in the endocrine system of your body, and you're not optimally healthy. But if you walk in to many doctors and you tell them that you've read about heavy menstrual periods and nervousness and tremors and depression and constipation, weight gain, and really intolerance to cold and poor growth of hair and nails, you think that you would like to be checked. The rigorous rules that they have laid down by serious mistake mean most doctors cannot and will not give you the prescription for thyroid you need unless they have done a special study and have become aware of newer guidelines that make it much more likely that you would get the thyroid that would help you. However, because much of this thyroid problem that I'm discussing is a result of the universal toxicity of our bodies, it is often not enough to just supply more thyroid. When I deal with many of my patients, I really have to support the adrenal gland, and I may well give people some pregnenolone and some DHEA, and I may well want them to have also some safe alternative to support estrogen function, which of course would be herbal remedy from Thailand, HRT, that Longevity Plus carries. And I want a lot of women to know how good topical progesterone can be. It's anti-inflammatory, and between iodine applied sometimes right over a breast that is having a problem, you can paint the breast with iodine. Topical iodine in any health, it is available at every drugstore. Now the skin immediately turns red, but when your body has a few minutes to a few hours, it will absorb the red and the iodine goes into the tissues. But in addition to that, topical progesterone, so I'm now telling you that when we want to optimize thyroid function, I often need to optimize the men with testosterone. The women need to have more progesterone, which can be applied topically. Anyhow, there's a lot to being healthy because we've all chosen to be on Earth at a time that we've managed to poison the Earth. And now, to add to it, in the lecture that I gave a couple weeks ago, we point out that you're on Earth at a time that, according to NASA, the National Aviation Space Aeronautics Association, is shown that there's been a collapse of the Earth's magnetic field. So even if you take everything that I'm asking you to take, you may not still operate as optimally as you should or could unless I teach you more about topics that involve physics. So now I'm going to have to put the physics back into physician, and next week those of you lucky enough to tune in are going to learn some amazing things that complement what I said 2 weeks ago when I discussed pulsed electromagnetic field. And for the next 3 weeks after today, I will be bringing you information on Tesla-based medicine, the Tesla form of electrical stimulation, and we will bringing you even exciting information about why you can sleep better, not only with the PM formula that I discussed a few weeks ago, which is getting to be extremely popular. People who have tried the PM product are amazed at how much better they're sleeping, and we find that some are going to wind up actually learning about the Vima company, and they might even one day want to sell some of this to a friend, because you don't want to be selfish. When you sleep so well that you wake up refreshed, you may want to share that with others. But iodine has this ability to actually help us kill off cancer cells, because apoptosis is a word meaning suicide. Now, every day you get rid of millions and millions of old cells that had reached the limit of their usefulness, and the body makes millions and millions of new cells each day. It's important to know that without iodine, this normal ability of a cell to recognize that it's done what it can do and it's at its end and commit suicide is impaired. So it's important to realize that iodine is so useful that we can find a huge difference in the incidence of fatal heart attacks in East versus West Finland, and we can test and find, because the biggest difference is iodine intake was drastically different between the two parts of Finland. And in fact, in individuals who have a goiter, the incidence of coronary artery disease is 353% higher. So there's an excellent book written by an MD PhD on breast cancer and iodine. His name is Dr. David Derry. And these slides come to us from the courtesy of my colleague, one of the brighter doctors that I'm pleased to know as a colleague, a former president of ACAM, the American College of Alternative Medicine, practicing in Nyack, New York, and Michael B. Schachter has put these slides together to help spread the word about iodine, because he does a lot of work with alternative cancer therapies, as does my friend Dr. Jonathan Wright. And he's been doing a lot of teaching about everything from bioidentical hormones to you name it. Dr. Wright is one of the leaders in nutritional medicine, and he has actually been advocating the use of SSKI, supersaturated potassium iodide, for a whole variety of conditions. Now, his newsletter points out that you really would have better health if you get 83 times the amount of iodine the so-called government experts recommend. And so what he's saying is the RDA barely scratches the surface. And most people are afraid, because of this bad information, to go beyond 20 milligrams. Many people really need to have 50 milligrams, and one drop of SSKI gives 50 milligrams. Now, obviously, when you start getting into these trace minerals, I said iron is vital when you need it, and bad when you have a problem and already have too much iron. So we like measuring ferritin and measuring your total body burden of iodine, so I'm sorry, of iron, so that we can give people iron who badly need it and stop people from taking a multiple, the multiple called beyond any multiple that is in all of the packets. The 9-pill packets we call Beyond Chelation Improved carry in it 3 of the tablets of the multiple called BAM, but you need that twice a day to get the recommended levels, because I've always been involved in mineral metabolism. And I always want everybody getting 500 calcium, but never the calcium without 500 magnesium. Don't take calcium by itself. Why? Because when you're 80 years of age, your arteries have 140 times too much calcium, and you need to take calcium only with the calcium tamer. You don't have a lion around without a lion tamer, and calcium helps kill. That's why they have calcium channel blockers to treat hypertension. That's why you can see on the x-ray when people are 80 years of age, you can see the outline of the whole blood vessel coming from their heart, almost going all the way down to their legs. So we need to know that there's a lot to understanding which mineral to take with what mineral and how much, and that's one reason we're glad to do these programs. So what's a good dose to be on? Suggested, if you're going to really optimize iodine, say you have somebody that has woken up suddenly to iodine and has watched many of the slides in this presentation take you to links, and the more you study it, the more you might think that this is a key part of your problem. Well, we don't want people to get sick, and there's always, the problem is there's always 1 in 1,000 that can't hardly handle iodine. And of course there's going to be, maybe 40% of people who don't need iron. Those would be men, because they don't have menstrual periods, and they've been getting iron in a multiple, which is going to help kill them. If you don't need iron, it helps kill you. So how much are we going to do? Well, these things on this are to tell you that you need a lot of water. Now, if I have everybody drink 2 quarts of water, you'll spend more time in the bathroom. But that's okay because I have everybody taking zeolite and my power drink and my BCI because I'm really convinced that we all have to detox. But in addition to drinking the water, we know that if we get some really what we call Celtic or Celtic sea salt in a teaspoon of this to a quarter teaspoon in a quart of water. But I always tell you this is 200 of the selenium in the multiple as long as you take the BCI twice a day or you get 6 of the BAM beyond any multiple yellow tablets. But everybody needs more C. That's why I'm so glad that I was able to help bring a vitamin C to this world that beats any other C that you can buy anywhere for any amount of money. No one has a competing form of what we call bioenergy C because it is a methylated form. It's a vitamin C delivery system. It has ribose and trimethylglycine and methylsulfonamethane, and we have proof with studies that we can get it so high in your blood that we can prove with a simple stick test we give you that the urine will have more vitamin C in your urine than any competing product because we can keep your urine at 100 milligrams, which is the yellow color. And that yellow color, which the stick we give you is green. And so you have to have the C in your urine or the stick stays green. It won't turn yellow. So we know that you need more magnesium, and then you can be talking about which product you want. Iodine is out there. It's a good product. And they have you start with a half a tablet and increase, but you could go for a short time up to 4 tablets because it's only giving you 12.5 milligrams. And we find that many of us need to fill the iodine tank. Just like I fill the tank of people who think they're going to die with some terrible infection that's killing them. And we found with World Health Organization that if we gave babies a couple 100,000 units of vitamin A, they don't die. Tremendous benefit, but nobody knows this. They've all been told that vitamin A is going to kill you. Well, vitamin A would be toxic if you took huge levels every day, but when you take it for a short time, it fills your liver and your tank, and you get over a cold in 1/3 the amount of time if you, as an adult, take 500,000 units of A for up to 5 days. When you're talking with iodine, you can take iodine in big quantities, but you don't take it forever. I want to fill the body's tank for it because remember, it's going to help push out lead, it's going to help you deal with the fluorine, and everybody on the planet, even if you have been lucky enough to always drink what you thought was healthy water, we now find that 40% of the bottled water companies in this country refused when asked by an independent organization to tell us what method they were doing to purify the water because it turned out 40% were merely bottling the actual tap water in their community. That makes me mad. Because if that's all they're doing, and by putting it in a bottle, they're always giving you a poison called phthalates, and phthalates are dropping our sperm count worldwide, then I would just soon go back and have them be honest and let me just drink the tap water instead of paying you $1 for a bottle of water that is doing nothing for me. So now that we get that idea out, that you can be detoxing, but you need to be drinking water, you need to do all these things, and we do know we can measure how much iodine you retain if we do an iodine loading test, but so many people probably needed more iodine that I don't wind up doing a lot of the testing. But the RDA of these things is way down here at the microgram level, and Japanese women are getting 13 milligrams, and if we look at it, they get no problem with that. So there's an anti-cancer effect when we get more. So we need all the anti-cancer effects we can get. So if we look at iodine toxicity, yes, there are problems, and I really adore Alan Gaby, and he has a book that everybody who really wants to be authoritative, it's called Nutritional Medicine, and it sells for a lousy $300. It has taken him 5 years of locking himself in a closet and going through 35,000 references to be able to give you a definitive guide that's only been out for 2 months that could change the practice of medicine if doctors really wanted to change. No, they don't have the time and they don't have the $300, and we understand that. But this book would tell you that sometimes there can be problems with iodine, and it's good to know that we need to keep things in balance. But most of those problems with iodine won't happen if you're lucky enough to follow this program and take the water and add the extra salt, selenium, vitamin C, magnesium before you start pushing in the iodine. So with this concern then, we want to have them say, how long would you stay on huge quantities? Well, some people are going to admit that one of the reasons people are feeling so much better when we get them on iodine is because some of them have stopped eating bread, and we're all getting too much carbohydrate anyhow, and the bread was giving them bromine. So Dr. Brownstein, who's been very, very much involved in the crusade to bring iodine to its rightful place in our diet, would admit that simply cutting down bromine in people is going to make people healthier. And so it isn't always how much iodine I put in, because the iodine, in a sense, is trying to help your body counteract the bromine and the fluorine, which you cannot avoid. It's in food. If you get any processed food, unless you eat everything directly from your garden and you raise it yourself, you have fluorine in your body. So Dr. Michael Schachter is one of the best doctors in New York, in Nyack, New York, and he's been doing this kind of advanced medicine. He's almost up to, I'm 76, he's not quite there, but he's been doing what I've been doing for 30, 40, 50 years, and this is a great, really good doctor. And we do know that if you want to understand the nuances of why I'm making such a big deal out of this, it's because fatigue is, it's going to bring our country to bankruptcy. People don't have the energy to think. They don't have the energy to learn. They don't have the energy to perform well on a job. And I don't like to have other countries beating us in the world markets. And so it's clear to me that if I could optimize in this book, hypothyroidism type 2 will absolutely help people, because he explains all the nuances of what's involved in how to know whether or not you can tolerate the thyroid that many of his patients are going to receive, as my patients are almost routinely going to be told to try a test of taking more thyroid. The worst that can happen is 1 out of 1,000 will have, with a small dose, and we always start on small doses of thyroid, a quart of a grain, still 1 in 1,000 could have their heart decide to jump in their chest and frighten them and actually act like it's trying to fibrillate or have a bunch of skipped beats, and that scares people. And if they're unfortunate enough to have that happen, all they had to do was realize that their body was super sensitive because their body was so low that they just proved they needed it a great deal. And of course there is cheap forms of thyroid that will have corn starch in it and other impurities. So when I use the special thyroid that I tend to prescribe, it has much less of these fillers and other things that could lead to you having an untoward reaction, because thyroid, after all, it's hard to be allergic to something your body runs with. But at the same time, Dr. Starr's very excellent book, along with his knowledge, because he himself changed his own health in a dramatic fashion when he began to realize that even though his tests done routinely by a doctor, because he didn't wish to treat himself, would have led him to the conclusion that his body didn't need any thyroid, because TSH and T3, T4 that are relied on are grossly misleading. They are understating the real need for thyroid. So to find a doctor who will prescribe thyroid for you, you need a doctor that's willing to think out of the box, and you may have to buy a book and be knowledgeable enough to see who are doctors that he's trained. And Dr. Hertog of Belgium has trained 25,000 doctors around the world, so we can find doctors who will be able to assist you, even though you may have what looks to your other doctors as no problem. Your TSH, T3, T4 are fine, but you still have no energy, you can barely function, and you do have all the signs and symptoms of low thyroid, including obesity, even when you're hardly eating anything, and hair loss, and the list goes on and on. So I think it's important to realize that the publications about iodine are easy to find on Google, and a lot of them are by a friend of mine, a former professor, OBGYN, at, I believe, UCLA or USC, Dr. Guy Abraham. And he has done a lot to bring this message to the public, because as much as I love selenium, and believe me, I'm the selenium kid, because you know how I feel about getting the mercury and lead out of everybody, and no one has all the money to stay on enough chelation, because you can't get the lead out of your bones unless you take basically a 15-year oral program. I don't care how many intravenous chelation you take in a year, you could have 100 IV chelation and you haven't dented the level of lead in your bone. So since I'm passionate about trying to restore health to people so they can have the energy to fulfill what their life's purpose was supposed to be, I'm very open to responsible doctors like Dr. Guy Abraham, and he and I worked together a long time ago on the establishing the clear-cut fact that if you have a lot of women with premenstrual tension and a lot of symptoms around the menses, that many of them would respond better if we gave them more magnesium than calcium. But that's difficult to do because magnesium can cause a little diarrhea, and most people can't read the label when they buy a bottle of magnesium. They look at the tablet and it says 500 milligrams. They don't realize that 500 milligrams could all be the carrier, and only 100 milligrams would be magnesium. So these things get a little complicated, and when we start talking about how much iodine, as you saw when I gave you the slides a few back, I said I need to have you buy some healthy salt and drink good water and take extra selenium. Now let's make that clear. I would be an advocate based on the book I wrote on detoxing with oral chelation. If you read that book, you would see a whole chapter in there from one of the leading authorities in the world on selenium, Dr. Schrauser, who's been emeritus at the University of California, San Diego for years, and has been the head of international meeting of doctors interested in metal binding. And this doctor will have everybody take 600 micrograms of selenium every day, but across the board, I'm sorry, milligrams, but across the board, it's difficult to learn all of these things. How much iodine can I tolerate if I'm getting adequate levels of chromium and selenium and vitamin C and taking my sea salt? The whole game changes. You see, what I'm leading up to is this. If you went online on Google and you went in and put in iodine toxicity, you'll find some stories that would make you afraid to get the iodine you will need to stay healthy. Now, why are there going to be those horror stories in there? Because a lot of people are having to treat themselves, and they hear about iodine and they jump in with both feet, and they may have such an overwhelming magnesium deficiency or such high levels of lead or need the vitamin C, etc. So you can see that that's why I wrote my whole program around fight for your health. Because when I get you to have to go to the F and realize that's food supplement and which food needs to be eliminated, food is F, I is infection, G is genetics and epigenetics, H is heavy metals and hormones, and T is toxin. So in this page alone, they're going to link the fluorine and the bromine, the perchlorate, and these things I've given you an overview of. There's a really amazing doctor of Oriental medicine and acupuncture, Dr. Mark Allen Circus. Dr. Circus is down under, but he is always on top when it comes to a topic. And he has really made people aware of taking iodine even in a nebulizer to get it into the lung when there's thick material, as there would be in cystic fibrosis, and using it in douches. And it's not just a thyroid stimulator. It is used throughout all of the medicine in our body. And so the more we learn about understanding that it is a universal medicine, and by the way, his book is downloadable online, and I think it's something like $15, and it's extremely up-to-date and heavily referenced. So as you start to become knowledgeable, you're going to want to plug that into the more complicated issues that I raise when I talked 2 weeks ago about pulsed electromagnetic field. And last week when I mentioned methylation support for our memory, and I brought in that talk, I waved in the idea that I am now seeing that everyone that I treat with all of my knowledge of only practicing 53 years And every trick that I have, and I go to every nutrition conference, and I think I know as much as can be known about the overall number of nutrients that we now consider essential or semi-essential, which include mucopolysaccharides and RNA, and the whole idea of essential fatty acids is when I wrote the book, The Omega-3 Miracle, and then the essential minerals and the vitamins, and the list goes on, and it's so confusing to you poor patients out there, because you hear me talk about magnesium, but I can't in one lecture mention that magnesium often will never be optimal until I give you some intravenous magnesium, which we call Meyer cocktail, and I have you see some of the ACAM, or the doctor members of ICIM.org, International College of Integrative Medicine, also ICIM.com. But these organizations, ACAM, ICIM, and other groups, now Institute for Functional Medicine, which has been based on the work of Dr. Jeffrey Bland and is under Dr. Mark Hyman. These are organizations that have doctors that will think along the lines that I'm telling you about. And one of my friends, Dr. Sinatra, has made people aware that we need to walk in the grass, with wet grass, with bare feet. And because we're all isolated, we are not getting the earthing, and this is going to be a little more complicated because those of you who come to my conference, which will be held in Phoenix at the Marriott Buttes, which is very short, free shuttle ride from the Sky Harbor Airport. If you're there, we will be speaking and teaching every single day from March 3 through March 7. So that starts Thursday night and doesn't end until the following Monday night. And at that time, I'm going to have a chance to go into some detail, because I'll have a lot of details about what happens if you're sleeping on a magnetic pad, because that's called magnetical sleep by Dr. Bindley is now shown at Johns Hopkins to raise the ATP, that's the energy of each cell. Now, if I can get all your cells having enough energy, they will incorporate the iodine we're talking about, and the selenium and the extra C. So it's one of the reasons I got so excited about pulsed electromagnetic field therapy, because it gives you the vital energy for your cell to benefit from all these things we're talking about. But this is an obvious, simple idea. If you never get your shoes off and you're always standing on asphalt and you've never been grounded, you will have a buildup of too much electronegativity, and you need to discharge that, or electropositivity. Now that will depend whether you're in the city or the country, and so sometimes the answers are going to have to be kind of personalized for where you're at, but we'll be teaching all that at my conference, which is at and combined with the Arizona Homeopathic and Integrative Medical Association. Now there's still plenty of room to get into this conference, where we have 24 speakers on AHEMA, and those 24 speakers are some of the leading members of my state's association, because you see there's Nevada and Arizona that have made these special regulations that have a separate board of what you would call integrative, complementary, alternative, homeopathic, whatever you call it. We have separate boards. So if you're an MD or DO and you wish to become a leader in integrative or CAM therapy, you can be licensed separately by these boards in these two states. So if you come to this conference, you're going to be exposed to ideas you're not getting exposed to now, whether you're a physician or a patient, because I will be starting on the 3rd, so I'll be doing on Thursday night an overview of the whole idea of which is the new way with Tesla-based electrical stimulation to get, for an affordable price, some of the benefits that I am only achieving on my body when I can have access daily to the pulse electromagnetic field device, which is a $20,000 device. But we find at the conference I just attended of the Institute for Functional Medicine, IFIM in Orlando, that many, many doctors are so excited about being able to understand what happened when birds are dropping out of the sky. Has their magnetic compass been disrupted? What's going on when the NASA says that there's been a collapse of the Earth's electromagnetic field. And what does that mean? That means that you're down to 0.3 Gauss, and maybe about 250 million years ago when we had dinosaurs, we had 30 Gauss, and 30 Gauss supports metabolism. So at this conference, it will be my great privilege to have and work with the 24 speakers already part of this HEMA conference, but I'm sandwiching before and immediately after this conference, which is why we're there all day Sunday afternoon into early Sunday evening, and then all day Monday, covering these topics of Tesla-based electrical, as well as laser-based, as well as pulsed electromagnetic field, as well as static pads that you put between the top and the bottom mattress, and the pad weighs 100 pounds, and I have 2 of them between my top and bottom mattress, and they're expensive, but I wouldn't live without them. They actually cost $900 a pad, and they're likely to go up in future because Toyota has found they cannot make their electric cars work without magnets, and so the price of neodymium for making magnets has gone up 4-fold. Now, for some people that really want to explore beyond what we've said here today and are really on the pushing edge, and you want to know everything you can find out about every cancer therapy available on the planet, what you do, very simple, is you go to Explore, and you can read some of the free articles, and if you pay $29, you get a whole year's membership, and you can see what we call biological medicine as it is practiced in Europe, and learn about things that you know nothing about today that goes way beyond stem cells and way beyond any of the treatments available in our country, because we're quite good in our country with our amino acids and our trace minerals and our vitamins and minerals, but we are not always doing all the things that can be done. And I want to remind all of you that it is part of a new sustainability living that causes this city to have a new magazine called Green Living, and I'm so pleased that they have chosen to take one of my fight program each month, whether it's the food or the infection or the genetics, because remember, everybody listening to me now provably has an infection. Harvard says it'll be CMV. If it's not that, it's Candida, and if it's not that, it's XMRV, and if it's not that, it's chlamydia. And so the point is, so that whether you talk F or I or GHD, if you don't do something and find which foods you need to get off of and learn a good way to lower your total body burden of these pathogens, and a good way to get rid of the polybrominated diphenyl ether, I've talked about iodine, it's the tip of the iceberg. You're going to have to learn about far infrared saunas, and you're going to have to learn how the magnetic device is acting like 100 massages at once, and it's massaging cells that will pour out toxins that if you take my power drink and my Beyond Chelation and the zeolite, you will start to feel as good as I feel, and I think that's what drives me to always wanting to have everybody know that there is on my website lots of places to study. The Zeolite Answer is a website where I put up all this information about the volcanic material that I wouldn't go a day without. If you have a pet that you love, most of our dogs are dying these days of cancer, and you can only get so much vitamin C in them, but the zeolite, they tolerate it very well. So across the board, babies need zeolite. And this simple site, this is a retired former nurse that is sharing her time and teaching people how to beat Lyme, and has a whole separate site. So if we get more people to visit these sites, and there was great interviews that we did with Pastor Benny Hinn, and these, when he got rid of his problem of auricular, he had an auricular arrhythmia, he was in fibrillation, and we now know that these are all can be treated. He got well, and he's never had to live on the Coumadin and all the other drugs. And I do have anyone who's involved in the health field at all. If you are a health worker, you merely go to Gordon Research and you scroll down and you will see FACT. And when you join FACT, I send out 3 emails a day to over 3,000 health professionals now every day, so that I keep you abreast of the latest news. And believe me, I've been in 35 hours of lectures just in the last 5 days alone. And so it's impossible in these little get-togethers that I can bring you fully up on everything. But I invite all of you to please join us again 1 week from today, when you're going to meet Greg Westfall, and he's going to teach you about the magic of Tesla and what Tesla-based electricity can do with impossible conditions where people are going to have their leg cut off and they can't afford to get the chelation. They can't even get to a doctor's office, and we can help them at home. Or we can stop incontinence in women who are afraid to leave the house. Or we can take somebody that's been stroked and they have a paralysis of an extremity. We can put 10 inches of muscle back onto a leg. So don't miss next week. The following week, his associate, Michael Bianco, will be on, and the following week we'll have Dr. Dean Bonley, and he will be explaining his lifelong research as the head of the North American Magnetic Research Association. So stay tuned, everybody. We're going to continue to be sending out exciting new information, and FACT is free of charge to all health workers. And the reason I send 3 emails is not for you to take your time to read them. I'm sending the 3 emails each day, so I force myself to help build a database so when you're stumped with an impossible case of Crohn's disease or impossible autism or cerebral palsy or Parkinson's or ADHD or obsessive compulsive or a brain tumor and you don't know what to do, you can go with the password you get when you join FACT. And with that password, you have access to over 10,000 posts from leading health professionals around the world who help contribute to the database. So when you want to know about magnesium or chelation or short chelation or lead or anything, you have the answers at your fingertips. It's been my pleasure to be with you today, and I look forward to you attending next week and the week after and the week after, and to many of you being present in beautiful, beautiful Buttes, Marriott Buttes in Phoenix, actually Tempe, just minutes from the airport, March 3 through March 7. After that, I will be then April 15. I will be with ACAM in Minneapolis, and then I'll be immediately going directly from there to Orlando to be with A4M. So we will be traveling as always, and thank you again for your attention.
Thank you, Dr. Gordon. We encourage you to browse Dr. Gordon's website, which is www.gordonresearch.com. The products Dr. Gordon has formulated are available through Longevity Plus. Please visit our website at www.longevityplus.com or call 800-580-7587 to place your order. We value all of you